cost of health coverage continues to be a burden to taxpayers in this community. What would be your solution to this problem? Is healthcare reform a priority for you? And what details can you shed on your solution?
Quickly, just to clarify some things so that you get the right information. The councilman is absolutely right when he says that the state has to give permission to the city to raise taxes. Every tax except property taxes. They can raise or lower property taxes without anybody else's say so. That's the fact. And you guys know that. The second thing that you have to also realize...
That's part of your time, huh?
No, I understand that. The other thing that people have to realize is that when you have state-chartered institutions, we have say over that. Most of these banks and these mortgage companies are federally charging. And because they're federally chartered, that means we have no say over them. Healthcare is easy. Single-payer system. I'm a Barack Obama elected delegate. You elected me. Thank you. Next week I'll be going to Denver to do what you've asked me to do, which is vote for Barack Obama to be our next president. I support his plan for healthcare. Single-payer system, and we can start here in this state. We've already employed we've already insured every single child under the age of 18 in the state. Our next step is to go after everybody who's indigent and doesn't have healthcare, but we need a single-payer system. It's likely going to happen on the federal level, but there's much that we can do here in the state, and I'm committed to continue to work with my colleagues in the Assembly to make sure that gets done. Thank you.
Councilman Stewart.
I guess everyone here knows that my background is in the medical field, and I understand what the problem is as far as medical issues are concerned. The problem we have, brothers and sisters, is that all Democrats, every one of the Democrats, have a similar plan to have a one-payer system. And we all agree with that. There might be one or two parts that are a little different. But we all agree on the same principles. So to talk about this issue in that way as if we are different, I think is folly. The other issue I want you to understand is that what has happened in the past years, the past 6 years, as far as healthcare is concerned in Brooklyn, we had no representation as far as to help us. There is no issue there in terms of saying that we didn't have a representative. We have representatives in Albany, but we cannot reach him to deal with any of these issues, whether in the local office or in Albany. When you are missing from all these different forums, I'm surprised that he's here tonight. And the fact is, he's not there to do the votes, so how can he be responsible and say that he's dealing with these issues?
Councilman Kelly.
Mrs. Parker, you're clapping for me. I just wanted to make sure you stop. In any case, I think when it comes to health care, the only way that one can really understand the severity of the problem is by spending time in the emergency rooms in the neighborhood. And unfortunately, I have had to spend that time. I have 2 elderly parents. My father's 95, he has Alzheimer's, and my mother will never tell me how old she is. But I've been in the emergency rooms, and if you spent any time in any of the emergency rooms here in Brooklyn, you will find that we feel like we're in some place on Mars. People come in for care, somebody with a child has fever, a cough, something that can normally be handled by a good physician. The emergency rooms are flooded with people who should not be there because of, unfortunately, diseases that exist in those types of settings. People are immigrants are bringing their children there because they can't get care. And I would agree wholeheartedly with Senator Parker that the Child Care Plus program must be extended to families in general.